Hi, I'm Philip Chameau, Rhinoplasty surgeon. This is an outline of what your operative experience or journey at Melbourne Rhinoplasty, my private practice, would look like. So you have a concern with your nose and you book an initial video consult through the Melbourne Rhinoplasty website. I do all my initial consults via a video call, as I do quite specific rhinoplasty work, and I like to make sure that I'm the right person for you without wasting too much of your time or money. After that initial consult, where we'll outline your concerns and what you're after, then we may progress on to a face-to-face longer consult. And this will involve me examining your nose, outlining in detail what can be done and what this involves, including risks and expectations of surgery. I'll take some photos of your nose. This is required for any operation that may alter your appearance. These are kept in your confidential medical record and only shared with those involved in your care. Any photos used, like you may have seen used online, require your later, quite specific consent. For many patients, I may also modify or morph some of these images to help communicate and clarify what visual changes we're looking to make, just what's possible. We would normally meet for a third time to do this, as it can take a bit of time, and it's an important process to make sure that we're both on the same page. And this may be via video call or face-to-face. At the face-to-face visit, after the video initial, you'll be provided with a written quote, and the rebates will be explained for those with insurance that do have a functional component to their surgery. So an initial video call, then a face-to-face, and for some a third if we're morphing. Once you have your quote, you're in a position to book your surgical date if you want to proceed. For personal reasons, there may be a long time between when you last saw me and then wish to go ahead with your surgery, which is totally fine. But in these circumstances, I'll likely want to see you again. And of course, we sometimes just book extra pre-op consults if you or I feel we need to. My office will give you instructions then on preparing for surgery, when to fast, what medicines or supplements to stop, and your post-op instructions, but these are also available and printable from the website. You'll have your surgery, which is usually done as a day case, unless you've got other health concerns relevant to having an anaesthetic. We will check in with you the night of surgery or next morning, and your first post-op visit's normally about day 5 to 7. Everyone's post-op process varies a little, but a point of difference with me is that I do like to see people quite a lot during the recovery phase, especially in the first month when your nose is undergoing a lot of change, and little things, taping, silicone nose cones, massage can all make a big difference. It's not just getting the nose right in the operating room, but your nose will be quite mouldable for several weeks post-op, so making sure that after the swelling subsided, the splint and the cast are removed, and that several weeks have passed, that everything has stayed on track is really important. I do this same very hands-on, detailed post-op process for everyone, regardless of complexity. Rhinoplasty heal time is slow and the surgery is hard. We want to feel as though we've done the best job possible with the surgery and with the aftercare. Unlike nearly all other surgery, a poor result in rhinoplasty can just be the result of poor aftercare. Anyway, that's the journey. Follow-up is generally for 9 to 12 months and post-op photos are always taken. It may be longer than this, especially in complex revisions, but I'm always available down the track as the need may arise.